Irritable bowel syndrome, IBS, is a common gastrointestinal disorder that affects the large intestine, colon. It is characterized by a group of symptoms that can vary in severity and may include abdominal pain, bloating, changes in bowel habits, and discomfort. The exact cause of IBS is not fully understood, but it is believed to involve a combination of factors, including abnormal gut motility, visceral hypersensitivity, gut-brain axis dysfunction, and possible inflammation and gut microbiota imbalances. Irritable bowel syndrome, IBS, is a common gastrointestinal disorder that affects the large intestine, colon. It is characterized by a group of symptoms that can vary in severity and may include abdominal pain, bloating, changes in bowel habits, and discomfort. The symptoms can be intermittent and may improve or worsen over time. As previously mentioned, the exact cause of IBS is not fully understood, but it is believed to involve a combination of factors, including abnormal gut motility, visceral hypersensitivity, gut-brain axis dysfunction, and possible inflammation and gut microbiota imbalances. IBS can be categorized into different types based on the predominant bowel habit. IBS with constipation, IBS-C, individuals experience infrequent and hard stools, often accompanied by abdominal discomfort or pain. IBS with diarrhea, IBS-D, individuals have frequent loose stools and urgency to use the bathroom. Mixed IBS, IBS-M. This type involves both constipation and diarrhea, with alternating patterns. Unsubtyped IBS, IBS-U, when the symptoms do not fit into any specific category. Causes of IBS. The exact cause of IBS is not entirely understood, but it's believed to result from a combination of several factors. Abnormal gut motility. The contractions of the intestinal muscles may be irregular, leading to diarrhea, constipation, or both. Visceral hypersensitivity. People with IBS may have an increased sensitivity to pain in the gut, causing them to feel discomfort at lower levels of distension or gas. Gut-brain axis dysfunction. Communication issues between the brain and gut can affect how the digestive system functions, leading to IBS symptoms. Inflammation and gut microbiota. Some researchers believe that an imbalance in gut bacteria and inflammation in the digestive tract might play a role in IBS development. Symptoms of IBS. The symptoms of IBS can vary from person to person and may include abdominal pain or cramping, typically relieved after bowel movements. Bloating, feeling of fullness or distension in the abdomen. Changes in bowel habits, alternating between diarrhea and constipation or experiencing one more frequently. Mucus in stool. Some people may notice mucus in their stools. Urgency, the need to have a bowel movement urgently. Incomplete evacuation, feeling like you haven't fully emptied your bowels after a bowel movement. Diagnosing IBS involves a process of exclusion. A healthcare professional will consider your symptoms and medical history, conduct a physical examination, and may order tests to rule out other conditions with similar symptoms. These tests may include blood tests, stool analysis, and imaging studies. The primary goal of IBS treatment is to manage symptoms and improve the patient's quality of life. Treatment options may include dietary changes, identifying and avoiding trigger foods, such as certain types of carbohydrates, FODMAPs, caffeine, and spicy foods. Fiber. For some individuals, increasing fiber intake may help regulate bowel movements, but others might need to reduce fiber intake if it exacerbates symptoms. Medications. Depending on the predominant symptoms, medications like antispasmodics, laxatives, or antidiarrheal agents may be prescribed. Stress management. Techniques like mindfulness, yoga, or meditation can help manage stress, which may improve IBS symptoms. Probiotics. Some studies suggest that certain probiotics may provide relief for some IBS symptoms. Peppermint oil. This natural remedy may help alleviate abdominal pain and bloating. It's essential to work closely with a healthcare professional to develop an individualized treatment plan that addresses your specific symptoms and needs. IBS is a chronic condition, and management strategies can vary based on the severity and type of symptoms experienced.